About half the people who smoke cigarettes try and quit a couple of times each year. Many say it would help if they could cut back before trying to quit completely. A new study looked at whether using a specific smoking cessation medication called varenicline, or Chantix, could help them do that. Smokers in the study were asked to gradually reduce the number of cigarettes they smoked, then try to quit entirely after 3 months. People using the medication were 4 times more likely to not smoke after 6 months and 2 times more likely not to smoke after a year. There's help right here in the Mid-South for people trying to quit smoking. Weekly classes at Baptist Hospital DeSoto are helping people quit in part by helping them cut back first, then offering support and help with nicotine replacement products. As Doug Johnson reports, the support that people receive in the classes also helps them in their efforts to quit.
Cigarettes kill. In Mississippi, 5,400 adults die each year due to smoking, and more than 190,000 children are exposed to secondhand smoke. In DeSoto County, South Haven joined 83 other towns and cities across the state in banning smoking in public places. While that may encourage some smokers to try quitting, it's still a challenge. But the health risks from smoking make it a challenge worth taking.
Long term, especially with the lungs, you've got emphysema and what people know as COPD. It also causes you to have heart disease.
Even with the well-documented dangers of smoking, quitting is not easy for most smokers. That's how it's been for Becky Munns, a smoker for more than 35 years. The Coldwater, Mississippi stay-at-home mom has tried to quit before, but really wants to succeed this time because of several good reasons.
Health problems. I had a heart attack, and then they had to go in and blow out my stent again. So, and my kids, my grandkids, and basically for me, because, I know it's bad and I know it's hurting me. And I want to be around a little bit longer for my kids, especially my grandkids.
Nicotine in cigarettes can cause a chemical addiction for smokers, which is difficult to break. And for a lot of people who smoke, where, when, and how they light up become part of a sometimes elaborate ritual, smoking in the same circumstances all the time, so that it becomes ingrained.
A lot of times you smoke in a given situation just because it's what you've always done, and then those behaviors mesh together. So if you drink coffee and smoke, then every time you start to drink coffee, you're going to go for a cigarette.
Well, I think it's basically the habit. It's what you get used to, hand to mouth, and as soon as my feet hit the floor in the morning, I was getting something to drink and a cigarette, and then especially after I eat, I want one, and it's just a habit.
Baptist Memorial Hospital DeSoto offers regular classes in the hospital designed to help people who want to quit smoking.
A lot of the people enjoy it. They tell me that this is what they've really needed because there's also other people in the class. They develop a rapport. One person can say, "This helped me," which may help another person.
People in the class can smoke as much as they want the first week, then slowly decrease their nicotine intake each week after that. The hospital has partnered with Walgreens to offer discounts on nicotine replacement therapies, gums or patches, to help. Instructors work on the behavioral connections and situational cues that trigger smoking and how to break those connections. With support from her family, Munns says this time she's making real progress.
I can breathe better. I can smell better. And basically, I just feel better.
A new series of classes begins at Baptist Hospital DeSoto every 6 weeks. Classes are held every Thursday at 5:30 p.m. to give people a chance to get there after work, and they run about 45 minutes. For more information, you can call 662-772-3000 and leave your name and number. They'll call you back with details. For Smart Medicine, I'm Doug Johnson.